Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And here at Gold, we're getting ready for our Gold Neonatal online conference. It's just around the corner. We get started on June 3rd. And with me here today is Dr. Christine Kahn, and we're going to talk about her upcoming presentation. Welcome, Christine.
Hi, thank you.
Oh, it's so wonderful to have you here. And, I'm looking forward to this topic. Your topic here is titled The Transition to Oral Feedings and Establishing Direct Breastfeeding in the NICU, Literature Review and Breast Practice Overview. So I'm very excited about that. But before we go into this, can you tell us a little bit about yourself? You are a neonatal occupational therapist and a lactation consultant, right? So tell us a little bit about your work and your background.
Yes, so I'm an occupational therapist. I first started in, just pediatric occupational therapy and working really in the early intervention. Got my advanced practice in feeding, eating, and swallowing. So really just focusing on eating that first 3 years of life and then kind of doing some swallowing evaluations. Then I went into the NICU for the other half of my career and yeah, I just kind of fell in love with breastfeeding. And so I already had the feeding background, I already had the developmental background, but I wanted to go a little bit further more with the breastfeeding. And so I went to get my IBCLC and realized that breastfeeding in the NICU is really just kind of like a reward, like a not that it was very rare that breastfeeding happened in the NICU. And so yeah, so that's kind of what brought my passion to kind of really encourage more direct breastfeeding in the NICU. And then so my last couple years I've been really just focusing on encouraging more direct breastfeeding in our NICU.
That's wonderful. Yeah, you mentioned something important here. I feel like in the last few years, we really have realized the importance of human milk for NICU babies, especially with neck and all these kind of other things and for the development. But as you mentioned, it's often, pumped breast milk and the breastfeeding is kind of that not an afterthought, but it's like, okay, let's get that baby stabilized. Let's make sure, nutrition is going well and all the other things have priority, and also to a certain degree understandable because they want to release dispatch the baby as soon as possible, right? So the baby can go home. And often the misconception is, oh, that's best achieved by bottle feeding because then we can measure how much the baby is getting and this and that, right? So and I feel like now bringing in this direct breastfeeding approach is so important. And showing that, yeah, that doesn't mean that the baby is going home later, but it's so beneficial and not only contributing from a nutritional standpoint, but for bonding, for developmental development, and so much more, right? So talk to me a little bit about that.
Yeah, so I think there's a lot of misconception about direct breastfeeding in the NICU. Like maybe a preemie baby can't direct breastfeed, and in some ways it's true, depending on the gestational age. And I think because sorry, that's my daughter. And I think because we're always in that quick transition of trying to get them to eat their volume. Can a baby directly breastfeed, consume their whole volume? That's why I wanted to present to you the in the literature, what is the current best practices to one, how to transition a preemie baby to take their whole full volume, and then two, how to encourage more direct breastfeeding in the NICU in addition to taking their volume. So I wanted to give you guys some practical tools on how to measure your some standardized tools that you can measure feeding readiness, and also some standardized tools to measure the quality of the breastfeeding. And what does the literature say about direct breastfeeding? And it was actually pretty surprising. There are actually literature out there that are starting to develop programs on how to support direct breastfeeding in the NICU. And so that's why this presentation is called a literature review, because it is a review of literature, and I kind of just scattered my own personal experiences in addition to the literature.
Beautiful. Thank you so much for clarifying that as well, because as you mentioned, there is evidence in, based information now available, research, which is so important because often if somebody is trying to introduce, direct breastfeeding initiatives in the NICU, sometimes there might be some pushback saying, oh, what does the literature say? Is there even any evidence? We're like doing what we're doing because we know there's, research available on it. But now that you're saying, yeah, there is research available on this, this is helpful information for our viewers who are thinking of increasing their direct breastfeeding rates or even bringing a program to the NICU for, this to introduce the topic and have the transition from oral feedings and establishing direct breastfeeding in the NICU. So that's definitely very helpful because it is always helpful to have something in your hands to back something up when you're introducing something new
Yeah.
there.
And my goal is to have a very practical presentation so you can see the practical things that I do, the practical things that they suggest, and see
Mhm.
what works for your NICU because every NICU is a little bit different. And there's also common barriers across the nation about what prevents direct breastfeeding. So if we can identify the barriers and then we can
Mhm.
address it and then also just have tools to how to move forward, that's my goal. If we can just increase direct breastfeeding in the NICU, then that's wonderful.
So tell me a little bit about these barriers, just briefly. I know you will be talking about that in your presentation, but just a few barriers that you have seen here. And yeah.
So one is actually not really within our control. It's actually just the hospital setting. So one barrier is what is the visitor hours of like is it parent friendly? So sometimes some NICUs they close it from especially during the pandemic, only moms were allowed to come in. But now they've opened it up, but the visitor hours is one barrier.
Mhm.
The other is the access of a lactation consultant. Even in our NICU, we do have lactation consultants in our floor or in our building, but they don't come to the NICU often. They're mostly in the postpartum. So then, since OT is more common in my NICU, I'm more readily available. But in the research, it shows that there's only like less than 40% who are full time in the NICU, and even less. So most of them are more per diems. And so the one is the hospital culture, one is the policies. Some of them don't even have feeding programs.
Mm.
Like so that's also important too because we're trying to transition away from volume driven to more Q based. And if you don't really have a policy on your feeding program, then it's kind of free for all,
Mhm.
based on caregiver experience. And then for that one baby, they just may be experiencing a lot of different types of touch and a lot of different types of way of feeding. And then the other is kind of if the baby is gaining weight, medical stability, but there's also skin to skin practices.
Mhm.
If you don't have a policy for skin to skin, that's also a big barrier. So those are just a couple common barriers that prevent direct breastfeeding in the NICU.
Well, thank you. And I know you will be addressing, going more in detail in your presentation, so we don't want to share too much. Um, Christine, Dr. Kam, before I let you go, any last words for our viewers, what you're hoping to achieve with this presentation?
I think I just hope that after you see my presentation, you would feel more like that it's possible to direct breastfeed in the NICU and that you can do it.
You can do it. Well, thank you so very much for being here with us today and talking about the background, and your wonderful work you're doing in your NICU and the presentation here at Gold. Thank you so much.
Thank you.
And some information for our viewers. Now, if you would like to find out more about this presentation and all the other presentations of the Gold Neonatal online conference, we invite you to go to goldneonatal.com. As I mentioned, we get started with our open access, free of charge keynote presentation by the amazing Dr. Niels Bergman on June 3rd. And so check out all the information on our website and reserve your free seat for the keynote presentation, and make sure you share that with all your colleagues and friends in the field. Thank you, everyone, for watching, and have a lovely rest of your day wherever you are in the world. Bye-bye, everyone.